Welcome. Welcome,
Thank you.
Dr. Hamami.
Thank you. I would like to share the screen just for a quick presentation on where we are today. Can you see my PowerPoint?
Yes, we can.
Very good. Thank you. So, as always, we are talking about the week before. So, this is the period of May 2nd to the 8th. And we'll start with the confirmed cases. We are on the right track. This is the fourth week in a row where we are seeing our cases declining. The number of total cases that were reported during last week were 1,789 cases. That is close to 33% less than the week before, where we were at 2,672. The same is applying to the number of deaths that are being reported as well. Last week, there has been a larger number of deaths than expected, but it is due to some data dump that the state does every now and then where they update the causes of death. It is not because of any spike in the virus or in the infections. These are things that over the past year we have been observing. Our testing capacity still remains to be solid and robust, and we are seeing more testing as we go along. This is the 14-day look back, and if you remember a couple of meetings ago, that trend was going upward. Now it is going in the right direction, and we would love to still see it continue in that way. This is, they say, a picture is worth 1,000 words. These are the ebbs and flows of what we have been experiencing since the beginning of the pandemic. As you can see, we had one peak in March and April where we thought that that was a decent peak. It is modest considered to what we have experienced back in December and what we experienced as well in the past month or so. But again, the good thing is that this steep slope is going down, and again, we are on the downslope of this peak. Our positivity rate goes back to the single digits. As you can see, we were as high as 16%. For this period, we at the county are 9.5%, and the state as well at 8.9%. So again, all these are good indications for the improvements in what we are seeing. Our top 10 communities are still relatively the same. We have absolute numbers of cases that have decreased. However, the percentages still are within the limits of what we have been seeing in the past, almost the past year. Dearborn remains as the community with the largest percentage of cases out of Wayne County at 10%. Taylor and Canton come with 8% of the total cases. Westland at 7%. Livonia and Dearborn Heights at 6%. Redford, Hamtramck, Romulus at 4%, and then Inkster and Belleville at 3%. As far as the variants, still the most dominant variant is the UK variant, the B117. We have a total of 862 cases, and then we have relative lower amounts of the others, specifically the two California variants, the South Africa. Last time I reported to the committee, we had the P1, which is the Japanese / Brazilian variant. We had 3 cases. Now we're up to 13. And we have received from MDHHS a confirmation that we have currently 3 confirmed B16172, which is the India variant. These are 3 cases. 2 of them are in the same household, and we are conducting the contact tracing. We identified 4 more of these 3 cases that are connected, and some had a connection with someone who had traveled to India. We are still looking over these cases. My apologies, it should not happen. We are still looking over these cases and continuing to monitor that. In terms of school-related cases, we only have 1 new outbreak. There are several that we are still monitoring as ongoing, but we have only 1, which is in an elementary school in New Boston, 8 positive cases in both students and staff. Our vaccine inventory is good. We continue to receive amounts as needed. The state has shifted to back to, instead of allocation, to more a request. We know that several of the health systems are skipping some of the weeks and not ordering more than they need. Our total inventory so far, we have received 200,098 and 222 doses, and we administered 162,683 in total, and we redistributed 66,924. If we want to look at the number of doses that we have administered between the Pfizer and the Moderna first doses, we have already administered 83% of our first dose inventory and 74% of our second dose. We, as everybody else is experiencing, we are seeing a lower uptake of the vaccine, and therefore our shipments are now going back to not ordering more than we can use. Our vaccine sites, as you know, we have our standard 2 sites at Schoolcraft College in Livonia and Wayne County Community College in Downriver campus in Taylor. Those are now operating at 6 days a week capacity. We have established 2 new sites at Flat Rock Community Center and Wayne County Community College in Belleville. These are also operating at 6 days a week capacity. We are starting 2 new sites. Tomorrow will be the first day. Tomorrow will be extended hours. I believe the hours of operation are from 11 to 7 or noon to 7. I can double check on that. And these 2 sites are at Lincoln Park Community Center and Wayne County Community College in Harper Woods. The goal is to, tomorrow it will be the first day that we're starting. The goal is to establish 6 days a week operations as well in the next week. We are boosting our emergency preparedness staff to manage these new locations, and this is where the schedule will become 6 days a week. So we have 6 sites that are able to provide any number of doses between 1,000 to 3,000 a day. Of course, we are not seeing that, but we are prepared to do so. The other things that we are working on as well are community micro sites or micropods. These would be 100 doses at maximum. We're working with faith-based organizations, community centers, and some of our municipalities where there is a high social vulnerability index as well as lower vaccine intake or vaccination rate, and we are looking to establish pop-up sites, we're calling them, and doing those as needed. We are also working with the schools. Tomorrow will be our first school clinic at South Redford School District, I believe. Yep. At South Redford School District in Thurston High School. We also are going to be at Plymouth County School on May 13th, Van Buren Schools on the 15th, and Northville Schools on the 22nd. We are working with RISA, and we have a meeting this morning with the school superintendents. We will be holding school vaccination clinics for students. Currently, we're focusing on high schools, but with the news that the vaccine is going to be available for 12 to 15, then middle schools are going to be included. And we believe this is a win-win situation where many of the students cannot drive, and maybe their parents are at work or challenged with transportation. So taking the vaccine to where they are, working with the schools, is a strategy that we are endorsing and we are going through. I wanted to throw 2 slides. Many of you have contacted either me personally or the health department and asking about the Michigan Lighthouse data and how can we get this data in a more informative way. The data, excuse me, the data is kept by, excuse me, is kept by the state. And the state updates this data on a daily basis, I believe. We have the ability to download the data, and with it come reports. So these 2 reports are useful in understanding what is happening in out of Wayne County, excluding the city of Detroit. So as you can see, These graphs on the left are those that are fully vaccinated. That means everybody that had 2 doses of the Pfizer and Moderna and 1 dose of the Johnson & Johnson. The one to the right are anybody that have received at least 1 dose. So if we want to look at anybody all over Wayne County 16 and over, then our vaccination rate for fully vaccinated is 40.5%. If we look at anybody that received 1 dose at least, then the number is higher, it's 55%. Of course, there is a 3-week lag or 4 weeks lag for the second dose, and this is why. So in 4 weeks, this fully vaccinated will be 55%, and it will be more. The good thing about this is looking at those that are 65 and older. Of course, these are the most vulnerable, our senior population, and we have 74%, almost 75% of our senior population in Wayne County that have been fully vaccinated, and 84% that have received at least 1 dose. Now, the question that everybody asks is, I want data for my community. At this point, this data is available only through the census tract level. And census tracts are challenging because census tract can include different zip codes, more than 1 zip code, and it cannot be limited to a municipality boundary or a community boundary. We are talking with the state, and they told us that this requires geo-coding for the boundaries, which they are not doing at this point. For us to be able to get every community rate is a very much labor-intensive and it has to be done manually. We have reached out to the Department of Technology and Information Technology, and we're looking at some software that can take the census tracts and translate those to zip codes and then the zip codes to communities. But I wanted to give you those 2 pictures. On the left is anybody between the ages of 16 and 64 that are fully vaccinated. And even though you cannot see which city is what, it's more by zip codes, but just based on the numbers that you can see, then between the ages of 16 and 64, we are still below the 40%, and based on the shades of crimson that you can see, we are between 10% to probably 40%. Very few in this county map, very few are green where it's 60 and 70. But if you look at ages 65 and over that are fully vaccinated, that picture transforms completely. And most of these are green with higher shades of green. And we're looking at anything between 60% to 90%. So I wanted to leave you with this visual. And again, I know that many of you want data that relates to your community in terms of percentages.